Have you ever felt the surge of intense pleasure, only to be jolted by a startling realization? Nothing came out? Every sensation was intact, your heart pounding, breath racing, but the ending felt abruptly severed. No semen. No visible sign of a complete orgasm. And at that very moment, a haunting question struck your mind. Am I broken? I know. Many men, especially after 60, have silently gone through this, not daring to ask, keeping it hidden out of shame, fear, or simply not knowing where to begin. But you're not alone. And this, you may be surprised, is not rare at all. In fact, it has a very clear medical name. In today's video, I want to help you decode it fully, not with fear, but with understanding. This isn't a tale of decline or the end of manhood. It's a story of change and how you can reclaim ownership of your body. If you've been worried, if you've experienced this but never dared to ask, stay with me until the end, because just a few more minutes may help you breathe easier, understand why this is happening, and know it's not your fault. Are you ready? Let's begin. There's something few people expect, that there are silent changes within a man's body, especially after 60. No noise, no pain, yet they leave behind deep confusion. One such moment is a powerful orgasm, with nothing at the end. The man clearly feels the familiar contractions of climax, the emotions all there, but no semen comes out. It feels, for many, like a movie that cuts off at the climax. People call it dry orgasm, but in medical terms it's called retrograde ejaculation. Imagine a fork in the road inside your body. One path leads to the bladder, where urine is stored. The other leads outward, where semen is meant to travel during orgasm. And in the middle, there's a traffic light, the bladder neck sphincter. Its job is to control the flow. It opens for urination and shuts tight during orgasm. So semen flows out and not backward. But in retrograde ejaculation, that traffic light fails at the wrong time. Instead of closing, it stays open. And when your body contracts to push semen outward, it detours into the bladder, not out. The semen silently withdraws, mixes with urine, and is flushed away during your next trip to the bathroom. Strange, yes, but let's be clear. This is not dangerous. It's not cancer. It's not a sign you've lost your manhood. It's simply a small mechanical glitch, like a valve misaligned. And most importantly, the pleasure, the orgasm itself, is still fully intact. Only the visible part is missing. I once spoke to a 65-year-old man. He said, "I was panicked for weeks. Thought I was impotent. Didn't even tell my wife. Scared she'd think I couldn't perform anymore." I looked at him and said gently, "Sir, this is far more common than you think. That's why understanding this properly matters. When we understand, we're no longer afraid. When we understand, we see that our body isn't betraying us. It's simply changing, softly, and sometimes silently. I know men who've hidden this for years. Never asked a doctor. Never opened up to their partner. Just searched alone, quietly, in anxiety. But you're different. You're listening right now, and that means you're opening up to your body. That's the first and most important step. Retrograde ejaculation isn't a loss of manhood. It's a reminder. We all change. What we need isn't fear or secrecy, but to listen, ask the right questions, and act in time. Have you experienced something like this? If so, I hope this brings you peace. If you're still unclear, leave a comment. I'll explain more. Because when we stop fearing our body, we begin living in peace with ourselves. After 60, we stop racing time. We start slowing down to listen to the body, our lifelong companion. But this is when the body starts speaking up, not in loud cries, but subtle changes that confuse or embarrass us. One of them, coming without anything, the dry orgasm. And when this happens, the question becomes, why now, at this age? The answer isn't decline, as many believe. It lies in inevitable changes tied to aging, medications, or past surgeries. In simple terms, this is not your fault. Your body isn't betraying you. It's responding naturally to your journey so far. The first common cause, prostate surgery. Many men after 60 deal with nighttime urination, weak flow, incomplete emptying. Doctors often recommend TURP, a scope surgery on the prostate. It relieves symptoms but may affect the bladder sphincter, the very gate that keeps semen from flowing backward. When that gate weakens, semen may take the wrong turn. No pain, no danger, but sleepless confusion follows. The second cause, medications in your cabinet. After 60, most people take daily pills for blood pressure, prostate, diabetes, sleep. Many are life-saving, but some, like tamsulosin for urinary issues, also relax muscles, including the bladder sphincter. The result? That gate doesn't close tightly during orgasm, and semen flows into the bladder instead. I once heard a 70-something man say, "I take my blood pressure pills like clockwork." But one day after intimacy, nothing came out. Felt great, but strange. I panicked, thought I had cancer. I smiled and said, "It might just be that tiny pill in your drawer." The third cause, subtler but just as important, is nerve damage. Men with long-term diabetes, if not well controlled, may develop peripheral neuropathy. When nerves misfire, bladder control weakens. Other conditions like Parkinson's or spinal injuries also affect the gatekeeper muscle. These causes may sound complex, but once understood, they lose their power to scare. The key isn't panic or guilt, it's detective work. Once you find the root cause, the burden lifts. I've always believed health isn't just physical, it's also peace of mind. When a man turns 60, he needs more than cold facts. He needs reassurance that his body still matters. That pleasure is still real, even if it looks a little different. If you're listening this far, maybe you've found your answer. If you've been through this, or still have questions, leave a comment, so I know I'm not talking into the void, so you know you're not alone. Now that you understand why your body might climax without releasing, many men naturally ask, so what now? That's the most important part. Because knowing is not enough, you need a clear plan to move forward. Not a complex, intimidating medical protocol, but a simple, calm roadmap that any man over 60 can follow, with dignity, agency, and respect for himself. Step 1. Don't panic. Start gathering clues. The first time a man experiences a dry orgasm, he can be stunned. Some go silent, others spiral. Am I impotent? Is it cancer? Is it the end of my manhood? But honestly, 90% of that fear comes from lack of understanding. So take a deep breath and become the investigator of your own body. Ask yourself, when did this begin? A month ago? 3 months? A year? And what changed around that time? Did you recently undergo prostate surgery? Did your doctor prescribe a new medication for blood pressure or urination? Sometimes just recalling that one detail unlocks the whole mystery. Step 2. Become the detective of your own medicine cabinet. Let's face it, after 60, many people forget what exactly they're taking. I've had men hand me a whole bag of pills and say, "I just take whatever the doctor told me." But if you want control, this is the moment. Write down every medication prescribed, over-the-counter, or supplement. If any are for prostate issues like tamsulosin or are muscle relaxants, flag them. Don't stop taking anything without your doctor's guidance. Many of these regulate blood pressure. Quitting suddenly could be dangerous. Your only job right now is to record the information and get ready for the next step. Step 3. Talk to your doctor. But this time, you lead. Now bring all your clues. Timeline, medication list, symptoms, and book an appointment with your doctor. But go in not as a scared patient, go in as a man who knows himself. Say it plainly. I think I have retrograde ejaculation. It started about 3 months ago. Here are the medications I'm on. Could any of these be related? Are there alternatives we could try? Trust me, any doctor will respect a patient who speaks clearly and understands his body. You're no longer a passive listener. You're a collaborator in your own health journey. I know talking about something intimate with a doctor isn't easy, but if you can cross that bridge, you've done 80% of the work. Once your doctor understands the situation, they can switch medications, adjust dosages, or recommend new options. And sometimes, just one small change, and everything returns to normal. Or at least, the silent worry disappears. I once asked an older gentleman after walking him through these steps, "How do you feel now?" He smiled. "I feel like I got my control back. I'm not afraid anymore." And that's exactly it. Understanding, acting, and connecting. Those 3 things can change the way we live in our later years. So if you're going through something similar, please, don't keep it inside. Try these 3 steps. And if something's still unclear, or if you need it explained differently, leave a message. I'll be here not as a specialist, but as someone walking with you. Because aging shouldn't come with confusion. It should come with clarity, control, and peace. Now that you've understood why your body climaxes without ejaculation, and what to do to face it with calm and clarity, the next question many men ask is there any way to fix it? Is there a medicine, a method, something to make things like they were before? This is where medicine enters the conversation. Not to dictate, but to offer safe, thoughtful options that suit your body, your age, and your unique path. First, if the cause is a side effect of medication, this is the easiest case. Many prostate drugs, especially alpha blockers, like tamsulosin, relax the bladder neck muscle, causing the gate to stay open during orgasm. In such cases, doctors can simply prescribe another drug. That still helps urination but lessens ejaculation interference. I recall one man in his 60s telling me, "The first medication made peeing easier but ruined the other part. I went back, and the doctor switched meds. Now both work fine." One small change, a huge sense of relief. Sometimes just adjusting the timing or dosage of a drug helps. Instead of taking it right before intimacy, your doctor might suggest another time. It's about reducing its impact on your climax mechanism. However, in some cases, like after prostate surgery, the bladder neck muscle is permanently altered. In such cases, it's important to understand we can't reverse that structure. But that doesn't mean there's no hope. For men who still feel deeply disturbed by the lack of ejaculation, there are medications that help. For example, pseudoephedrine, typically for nasal congestion, has a side effect of tightening the bladder neck. This can help reduce retrograde flow. Strange as it sounds, several studies confirm its effectiveness in mild cases. But caution, this medicine isn't for everyone. It can raise blood pressure, cause heart palpitations, and should be avoided by those with cardiovascular issues. So never self-medicate. Only take it with specialist advice. For special cases, like men still trying to conceive, there are assisted reproduction techniques. Sperm can be retrieved from the bladder after climax and used in fertility treatments. But truthfully, for most men in their 60s, it's not about having children anymore. It's about feeling masculine, connected, and whole with your partner. And this above all is what I want to make clear. Ejaculation gone doesn't mean pleasure is gone. The intense contractions, The peak sensations, they're still there. What's missing is only the visible discharge. And that doesn't take away from the value or beauty of intimacy. That's why many couples, once they understand it, choose to adapt, support, and enjoy the new reality together. I still remember one older man saying after his checkup, "Now that I know it's not dangerous and I still feel pleasure, I'm not worried." My wife says, "As long as we're still enjoying each other, that's what matters." And that's the spirit I hope more older men can embrace. Understanding instead of panic, companionship instead of shame, peace instead of anxiety. If you're unsure whether you need treatment, my advice: talk openly with your doctor. Don't be afraid. Don't feel embarrassed. Together you can decide. Switch meds, use support, or just seek reassurance. Because in the end, the real question isn't whether you ejaculate, but whether you still feel like yourself. Still strong, still connected, still whole. Sometimes, all it takes is one honest conversation. And if something is unclear, or you want to know more, leave a comment. I'll be here, listening and sharing like a companion walking beside you. Some things, when judged by appearance, are easy to misread. A climax without semen might terrify some men. But if you go deep enough, ask the right questions, and stay brave, you'll realize it's not an ending. It's an ellipsis, a pause before a new chapter. A reminder that your body, though aging, is still your loyal friend. Sometimes changing, yes, but still worthy of love. Dry orgasm or retrograde ejaculation isn't a loss of manhood. It's a mechanical change, often due to age, surgery, or medicine. It doesn't erase pleasure. It doesn't ruin love. It doesn't make you less. What it needs is understanding, a thoughtful plan, and gentle acceptance. You have the right to ask. The right not to feel shame. The right to be heard by your doctor. And more than that, the right to feel whole, even if things look different. Because aging doesn't make us less. It just changes the way we should be cared for and understood. I made this video not to offer a miracle cure, but to start an honest human conversation. A space where older men's sexual health isn't taboo. If you've listened this far, you're already brave enough to care. To love yourself enough not to ignore what's happening inside. And if this story has touched you, if it eased even a small worry, leave a comment. Share a thought. Even just a, "I understand now," so I know this message didn't go unheard. And maybe, just maybe, your comment will comfort another man lying awake tonight in silence. You can also subscribe to the channel. More stories like this are coming. Not told with cold science, but with empathy, clarity, and belief that every elder deserves a full life. Thank you for staying with me to the end. Take care of your body, not out of fear, but because you deserve health, happiness, and confidence. No matter how many years you've lived, you are still whole. You are still loved. You are still a man. Stay confident and live fully always. You're not broken. You're just changing. And you're still worthy. Aging changes nothing about your worth. Your pleasure is still real and your story isn't over. You're still strong, still whole, and still deeply loved.